Hi there! I chose this case study because of my experience this past year nannying a little girl with Mowat-Wilson syndrome. Every case is different, but she specifically has facial deformities, trouble walking, she wore braces, intellectual disabilities, seizures, congenital heart defects, and she is non-speaking. She uses a device to speak. She is a sassy, funny, goofy girl and so much more than her syndrome. She has had to struggle with so much for acceptance and equality, especially within school, so I take any opportunity I can to educate about her syndrome. Mowat-Wilson syndrome is a well-described congenital malformation syndrome. The diagnosis of MWS may be clinically difficult because of the variability of the phenotype and the widespread nature of phenotypic features. Mowat-Wilson syndrome is very rare and has just been recently starting to be diagnosed, so we were lucky enough to find a case study on this specific syndrome. This case study is about a little boy from China who has the same genetic mutation as her and was just published in 2021. MWS has over 300 patients reported so far, making it a well-known entity of clinical dysmorphology. Because this syndrome is underdiagnosed, there is not a lot of research history, making it very difficult for the patients that have Mowat-Wilson and their families. What I find particularly interesting about this case is the wide range of effects on the little boy. This boy experiences facial deformism, failure to thrive, microcephaly, hearing loss, developmental delays, and intellectual disabilities. It is so interesting how this one gene mutation causes a great number of disabilities that come along with it.
So Mowat-Wilson syndrome is a rare genetic disorder that is caused by a mutation on the gene ZEB2. Now, ZEB2 is located on chromosome 2. And due to this, it is a genetic developmental disorder that starts at fertilization and continues on throughout life. Though that is true, the disorder sometimes doesn't become apparent until later on in life during the main development time, which is 9 to 14-ish, where it really begins to show. So I want to show you guys what I'm talking about. So picture this line of pool balls as your DNA sequence, and it is a singular chromosome. This is chromosome 2. Okay? Everything right now is in current working order. Okay, you've got these two pool balls, which are blue, matching colors, striped solid. And it goes pair, 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 pair. All the correct way, all set up right. Now, if this is location ZEB2, and this gets mutated and changes, this can cause Mowat-Wilson syndrome. See, now it's a pair, 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 mutated pair. And this specific gene is one that doesn't really become apparent until later on in life. And it can cause all kinds of issues, which Jalen will get into later, but I'm going to kind of talk about the physical issues that come with it. So a lot of individuals go through different cognitive issues as well as physical issues. So because of this mutation, sometimes people with this Mowat-Wilson syndrome can get Hugstrug disease, which is a disease that doesn't create the ganglia in your colon, which actually moves, your waste out of your body. So to demonstrate this, I'm going to move these to the side. I have a fuzzy blanket. Now, with this fuzzy blanket, you can see all these little tufts. Okay, picture this as your colon, and all these little tufts are your ganglia, and they're moving around, and they're taking that solid waste, right, and they're pushing it out of your body, right, all the way down and out like it's supposed to. Now, with Mowat-Wilson syndrome, sometimes that doesn't work because you don't have these ganglia. So what will happen is your body will process all your waste, it'll come down through here, and then it'll get stuck, and it won't move, which causes severe constipation. And because of that, there are surgeries that sometimes have to happen, and there's problems where you can turn septic and have all kinds of other medical issues due to not having these ganglia in your colon.
This boy's initial newborn period was uncomplicated other than failing the newborn hearing screening. This is common for Mowat-Wilson cases. They are not diagnosed until later in their life. At the age of 3, he was referred to the hospital because he could not raise his head and he cried easily. He had a cardiac murmur, and echocardiography revealed that intravecular septal defects and patent ductus arteriosus. Cardiac difficulties are also common and prominent in other Mowat-Wilson cases. Cryptorchidism was detected, and brain MRI showed corpus callosum angiogenesis. At the age of 22 months, the patient had facial dysmorphism, including ocular heterolysis, frontal bossing, rounded nasal tip, sparse eyebrows, prominent chin, widely spaced teeth, and uplifted earlobes with a central depression. Facial characteristics of children with MWS become more prominent as they grow up. All developmental milestones were delayed. He raised his head at 6 months. He sat alone at 12 months. He stood without assistance at 18 months. He walked on a wide base with support at 22 months, and he walked alone at 3 years. Surprisingly, he never presented with epileptic seizures during a follow-up. Seizures are very common manifestations and found in approximately 70 to 75% of Mowat-Wilson cases. But this case study didn't particularly discuss the child's behavior, temperament, or differences. But in my experience, the only difference that I have seen is the frustration of communication. Lily, the girl I nannied, was always a silly, happy girl, but she does experience more difficulties with communicating what she would want or what she would need since she is non-speaking. This causes her to express frustration by crying or other agitated behaviors.
The available treatment for this disease is rather rare right now because of the rarity of the disease. About 1 in 50,000 to 1 in 100,000 delivered babies have Mowat-Wilson syndrome. And all of the problems that come with Mowat-Wilson syndrome, because they are so different, whether it's cardiac problems, whether it's gastrointestinal problems, or seizures, or cognitive decline, it all has to be treated in individual different ways. So that could mean seizure treatments for one person, that could mean gastrointestinal surgeries for somebody else, and that could mean open heart surgeries for somebody else. But because of that, I think that the reason why this case study is so interesting and the reason why this case study should be explored more is because I think that it gives us more of a push to map the human genome system, to understand why this kind of thing would happen, to understand why a mutation on one spot on one chromosome is able to create such havoc as in our lives as humans. And so I think that that's why this case study is important. I think that this case study is something that is, even though it's a rare disease, is something that could, in time, provide us with so much incredible information as to how we function as humans. And it sucks that, 1 in 50,000 and 1 in 100,000 children, delivered children, have this disease, and that it's a genetic disease, and there's nothing that we can do about it, and it affects the mind, the body, and everything about us as humans. So that's why I think that this case study is so incredibly important, and that's why I think that this case study should be studied further, as well as the human genome. So yeah, that's my thoughts on this case study on Mowat-Wilson syndrome. Thank you for watching.
Here are some pictures of Jalen with Lily, and as you can see, when you're looking at Lily, you can see the facial dysmorphia and some of the muscle atrophy. You can also see the symptoms that we talked about with the eyes further apart, the eyebrows are super sparse, the way everything on her face looks, you can tell it's Mowat-Wilson syndrome,
which is characterized by typical facial dysmorphism, mental retardation, global developmental delay, and multiple congenital anomalies. Here, we summarize the clinical characteristics and gene mutation of a Chinese boy with Mowat-Wilson syndrome. He presented with facial dysmorphism, short stature, microcephaly, congenital heart defects, cryptorchidism, agenesis of corpus callosum, global developmental delay, and mental retardation. Furthermore, he demonstrated bilateral sensory neural hearing loss. This manifestation is less common in Mowat syndrome. A novel 10-base pair deletion mutation was identified in ZEP2 gene. This work is sure to contribute to expanding the mutation spectrum of Mowat syndrome. Our results may reflect the variability of the phenotype in mitral syndrome.